Nick, welcome to the Zero Emission Hospital 2030 Kick-Off Symposium in Berlin. I will take the opportunity to quickly introduce you to all our viewers and guests today. Nick, you are the Executive Director of the Lancet Countdown, and you are tracking progress on health and climate change in an independent and multidisciplinary research collaboration with 35 institutes worldwide. Nick has taken over by October 15th, so just 3 weeks back, the Sustainabilty unit of the NHS in the UK, and is there right now as a trained doctor, medical doctor, with a degree from the University of Western Australia, working on societal health and public policy. He is the founding director of the UK Health Alliance on Climate Change. And right now, we will be able to witness a small dialogue between Martin Herrmann in Munich and Nick Watts in London. Welcome, Nick Watts.
Hi, Nick.
Hi, thank you.
I'm very happy to have you here with us. And I would like to start with the first question, and perhaps you want to say a few words in addition to the introduction you got through Julian on yourself. But the first question is, what are you intending to do at the NHS? And what is the commitment that the NHS has just recently announced?
That's a big question, Martin. Firstly, of course, hi everyone. Thank you. I am so sorry. I speak no German. So I understood nothing that Martin just told you, but I have heard Martin speak many times before, and I can guarantee that it was full of wisdom and insight and a special kind of German humor, I think. If you speak no English, now would be a good time to go and get a cup of tea, I think. But I apologize. Thank you so much for having me. And on a Saturday too, on a Saturday with over 100 people. I hope it feels this way in Germany, but from afar, from London, it looks like something very, very special is happening in Germany. It looks like there is something that is really starting to wake up with the health profession and its engagement in climate change. It's really exciting. Martin, you asked a question, so I should answer it. You're right. As of about 10 days ago, I started with the National Health Service. National Health Service is, in the United Kingdom, the largest employer in Europe, largest single payer system in the world. We represent about 4% of the country's emissions, which is important and large. But what is probably more important is that our primary business is health, is patient care. And it's exactly because of that primary business that the NHS has turned around in 2020 and done what it did. Back in January, the chief executive, Simon Stevens, he said to us, listen, I think climate change is important. I think, in fact, the climate change emergency is a public health emergency. And I want to figure out just how fast the NHS can respond to that public health emergency. 3 days later, the World Health Organization declared a public health emergency of international concern in COVID-19. We spent the last 9 months, 10 months working simultaneously on COVID, on that short-term immediate threat. But we've also understood that the environmental, the health, the social, the economic inequalities that exacerbate and make COVID-19 quite as dangerous as it is around the world are very similar in drivers and very similar in impact to the same causes of climate change. And so the NHS has made no apologies in tackling both COVID-19 and climate change head on. On the 2nd of October, the NHS became the world's first health system to commit, national health system to commit to a net zero future. For us, this looks like net zero by 2040 for the emissions we control directly. And that is roughly a third of our emissions profile. But we understand that we have a position within the rest of the world and our supply chain and all of our emissions that come from that. And so by 2045, we want to see the entirety of our supply chain. And that includes then, it means we need a lot of help from health systems across Europe, across the world, to do that. Martin, just before I hand back, because you did only ask a simple question, 2040 direct emissions, 2045 for our total emissions profile, but that's a long way away. And so by 2028, we want to get, at the very, very earliest, by 2028, we want to get an 80% emissions reduction, because we know that there is a steep curve here if we are going to respond to this public health crisis. We're in the middle of responding to both COVID and to climate change at the same time. But I think if you look closely and read the report that the NHS has put out, it's really quite impressive.
I have one more question to you, which is more personal even. Why did you take the chance to move over from the Lancet Countdown, which is a great project, and we have done some work there together, to kind of being responsible for getting it done in the one of the largest organizations that the world has? I mean, it's a challenge.
I mean, it's an impossible challenge, isn't it? It's probably impossible, but God, imagine if you only got 70%, 80%, 90% of the way there. You would have transformed the way that a health system moves. You would have transformed the idea of what it means to be a hospital or a clinician or a health professional. I moved across because I think we are entering a new phase in the response to climate change, probably one that we should have been in a long time ago. We need to stop talking about all of the things that we need to do to respond to climate change. We need to continue, yes, we need to continue to learn, we need to continue to research and understand, but we need to rapidly move beyond that. We know that we only have 7, 8, 9 years to really start to bend down the emissions profile of the world. And if we don't start to, then we blow past the Paris Agreement. In the next 5 years, if we don't redouble our efforts, we blow past the Paris Agreement. So I jumped on to the NHS, partly for that opportunity, partly because I think that's where the world is moving. I think if we are still 10 years from now talking about the need for action, but not doing anything, we will have missed the boat. And I will probably look a little bit silly because everyone else, including everyone in Germany here, will have gone and started doing things, and I would have just been sitting there talking. But the other reason, Martin, I think is, and I'm sure this is something you were talking about. In fact, the only part of your presentation I understood was the quote from Johan Rockström, from our friend. Johan's right, of course, right? The real importance for the NHS, the real reason it's important to see a national health system respond is not the 4% of emissions. That's important, absolutely. 26, 30 megatons of carbon dioxide equivalent a year. So, sure, that's important. The real reason it's important is because it sends a message. It sends a message that as health professionals, we understand, as doctors, as nurses, as pharmacists, as public health professionals, we understand that the remit of the health system extends beyond the four walls of a hospital or a clinic. And we understand that we have a responsibility to engage in those broader determinants of health. What better way of sending that message than getting off the ground and doing something about it?
Yeah. Now, compared to the National Health Service, the hospital, which is today its kickoff here in Havelhöhe, is tiny. Yeah, it just has 400 or 500 patients. The staff is below 1,000, so it's tiny on one level. But it's the first one who is committing, and so for us today is a very special day. Now, from your global perspective, because from the Lancet Countdown work, you had always a global perspective, but now you have also the UK perspective. What does it mean, and what is the potential of a small but sizable hospital in Germany making a commitment like this?
It is everything. I'm trying to think. Certainly 5 years ago, it would be inconceivable that something like this would be happening. Probably 2 years ago, it would be inconceivable as well. And yet that demonstrates the pace of change that is happening, I think, around the world, but also and especially in Germany. My impression is things are moving particularly fast in Germany. Now, that's good because Germany's been a little slow. So it's good to see. It's good to see Germany catching up. It's good to see other parts of the world sort of catching up on some of this. I would compare it back to what happened. I think it was last year, maybe 2 years ago, in Newcastle in the United Kingdom. That was the first. Newcastle Hospital Trust was the first set of hospitals in the United Kingdom to declare a climate emergency and develop a really impressive, really credible local plan for how they were going to get to net zero. The very first thing we did when we wanted to figure out how to get to the net zero is we went and spoke to the team at Newcastle and figured out how we could build on that. I see no reason why 7th of November in 2020, 18 months from now, we couldn't start to see a similar thing happen in Germany. In fact, let's not say 18 months, let's say 12 months, because COP26 is coming 12 months from now. And if one health system around in the United Kingdom can do it, and if a hospital in Germany can do it, I think as we come out of this pandemic, as we start to reimagine what a resilient, what a sustainable healthcare system looks like, there's absolutely no reason why the German healthcare system as a whole couldn't make that sort of commitment.
Yeah. Now, Nick, we know each other since more than a year, and we have been partnering. We haven't been speaking very much, but when we speak, things get going. Yeah? And I know one of the things that excites me a lot is you're moving in this position, so you will be our partner for all the work we are doing here in Germany. And I also know that you rely on us to test things out that we can test out here that you cannot test out over there. So I think that's one of the things for all of us to take with us. This is not a one-way kind of conversation. It's a partnership. Every one of us who is doing work on this is a partner of the others. There's not a hierarchy. It's not one big thing or a small thing. It's really wherever we make progress and we learn things and share things, things get going. So I think that's perhaps a message you want to underline for all the ones who are listening today, that this is about partnership, learning from each other, and for each of us to see what is the next big intervention point that we can take. That is a quote now back to Schellenhuber, who was presenting today as well. It's about the timing and the courage to intervene when you feel it really matters. But this is also a function of partnership. Perhaps as a closing question, what is your expectation towards us in partnering with you and the other guys around the globe?
Yeah, Martin, I can't believe it's only been a year. That can't be right. It feels like it's been 10. But I think, again, that just underlines how much is changing, how quickly things are changing. What do I need from you guys? What do I expect from Germany and from the rest of the world? I expect to compete. This is a race for us to move as quickly as possible. 2040 is very, very fast for a healthcare system as big as the NHS. I want that date to come forward. I want to get more ambitious as time goes on. And so when Germany figures out some new tricks and some new clever ways to recycle nitrous oxide, when you figure out some new supply chain logistics that you can sort of start to mess with your local procurement for food, then we want to learn from that. And we want to together move that net zero target closer. We want to feed off one another's energy, right? This is going to be an exciting, exciting decade. It's going to be an exciting moment where I think we will turn around and realize that, hey, we were on the right side of history here. Finally, we have a pretty ambitious commitment, kind of ridiculous, really, around a net zero health service. But one piece, if you go through and read what we talk about in our broader supply chain and our broader procurement for the NHS, within the decade, the NHS will no longer purchase from anyone that does not meet or exceed our net zero ambitions, anyone. That means if the NHS is going to be able to do that, it needs other health systems to move with it. It needs pharmaceutical companies to move with it. We need every single part of the health service to move with us. In fact, net zero is by definition impossible unless we all move there. So my success, our success, the success of the National Health Service over here depends almost entirely on the success that you are having in Germany. So I need you in order to achieve that. But equally, I think you probably need us. What an exciting moment.
It's very inspiring for us to know that you are our partner, but we'll also compete and see if we can be more ambitious than you are. Thank you very much for joining us on your Saturday. And I know how much you work during the week. So, and good energy and good success in your next weeks, and greetings to your colleagues. We will meet them and we will need them. Thank you very much for joining us.
Thanks, guys.